Hello, everyone. My name is Dr. Nadia Ali, and today we will be talking about a very interesting research that recently was published with regards to dementia. So, the research was actually about the relationship between dementia and daily step count. This was published in JAMA Neurology. And before we get into the research, we'll talk a little bit about dementia in terms of what it is. So, dementia basically includes a variety of conditions that affect the brain. So, people with dementia experience memory loss, behavioral changes, they have impairment of their cognitive function. Secondary to damage to the brain, they also have loss of emotional, mental, and physical control. If we talk about the prevalence of dementia, unfortunately, 1 in 3 seniors dies with Alzheimer's or another form of dementia. Currently, we are finding that dementia is killing more people than breast cancer and prostate cancer combined. Unfortunately, in 2020, COVID 19 contributed to an increase in Alzheimer's and other dementia deaths by 17%. So, this is a grave problem with a lot of prevalence, and it has been linked with hospitalizations as well as death. It significantly affects the quality of life of individuals. So, if we talk about the stages of dementia, there are 3 different stages of dementia. There's an early stage of dementia in which the individual experiences forgetfulness, there's a decrease in spatial direction. They're still able to work and socialize and communicate, however, their judgment is decreased. They have mood swings and confusion when they're trying to arrange complicated things. There is difficulty in doing certain complicated tasks. When the patient progresses to the middle stage, the symptoms actually get worse, and the person starts forgetting people's faces and names and how they are related to other individuals, their friends, and their family. They start forgetting important events, and even simple tasks like self-care tasks are often forgotten, like eating their breakfast, lunch, and dinner. They start losing their personal possessions very frequently. The behavioral changes are much more noticeable. They have a hard time learning new things. They have a hard time communicating. And so at this point in time, the individual is considered to be mid-stage. When the individual reaches the late stage of dementia, that individual will need constant supervision because at this point in time, they have very little control over their bodily function. And they have major behavioral and personality changes. They are not able to take care of themselves. They are no longer connected with reality. They're no longer able to track time, space, or their personal needs. So, what we see is that this is a disease which progresses to a point where it completely incapacitates an individual, and that significantly affects the quality of life of that person, the family, the friends, and the community is obviously going to suffer because of what is going on with this individual. There's a lot of care that's needed, a lot of resources are needed at this point in time. So moving on, types of dementia. So what we know is that, even though Alzheimer's is the most common form of dementia in the United States, that is not the only type of dementia. Unfortunately, Alzheimer's is also the leading cause of death among dementia patients. It's considered to be the 6th leading cause of death amongst Americans. The second form of dementia, which is the second most common form of dementia, is vascular dementia. And vascular dementia has to do with the blood vessels. What that simply means is that, if the blood that's carrying oxygen to the brain through a blood vessel is interrupted, which means that the blood vessel gets blocked, either there is a hemorrhage or there is clotting, then the part of the brain that was being supplied by that blood vessel actually does not get adequate oxygen. And that leads to death of that area of the brain. And so the dementia that results from the blockage of the blood vessels is termed as vascular dementia. Unfortunately, it's a dementia that's often undiagnosed or misdiagnosed. The third form of dementia is called Lewy bodies dementia. In this dementia, an abnormal protein gets built up in the brain. This type of dementia is often seen in Parkinson's disease patients. Although the protein that is accumulating is a protein that is also found in normal healthy brain tissue. However, the problem in this case is that the protein built up here is much more, which results in loss of nerve connections between the brain cells. In addition to the normal dementia symptoms, patients who have Lewy bodies also show some other signs such as hallucinations. They have stiffness in the body, they have tremors and shaking, and there's a flip-flop of attitudes and behaviors. The last form of dementia that we will talk about is the frontotemporal dementia. And interestingly, this dementia happens because there's a part of the brain called the frontal brain or frontal lobes of the brain which lose a lot of nerve cells, and that results in frontotemporal dementia. In this dementia, there are two major patterns that we see. The first is a loss of language comprehension and communication. And the second is that there is a drastic change in personality and behavior. So those are the four types of dementia that are commonly seen. And now we get to the study that was recently published. The researchers were trying to investigate what is the optimal count, a step count, that is needed to prevent dementia among adults. Now, the sad part about dementia is that we do not have any medications that have been shown to prevent dementia. And as far as the treatment is concerned, the FDA has approved two types of medications to treat dementia symptoms. One group is called choline esterase inhibitors, and the second one is memantine. Unfortunately, these drugs can only work in mild to moderate dementia. And there is also the second issue with these drugs, and that is that there is no clinical evidence right now that these drugs are going to work beyond 1 year. And some patients do not benefit at all. There is one new drug that was recently approved, which is aducanumab. Unfortunately, we do not have any evidence that it can restore lost memories or cognitive function. And so we are at a difficult point in time because we do not have anything to prevent dementia, and we really do not have great drugs to treat dementia. So the best way to go about in this situation is to actually prevent dementia using something which is easily accessible and something we can all do. And that is step count. So we now know that a higher step counts can actually lower the risk of dementia. So the more number of steps that we take, the more we can prevent dementia. Interestingly, we can actually prevent dementia, or we can reduce the risk of dementia by 50% if we can walk 9,800 steps a day. Or in simple words, what we need is we need 10,000 steps a day to be able to reduce dementia by a 50%. And that is, I think, amazing, because we have no drugs that are even close to this number in terms of, doing what 10,000 steps can do. So this is something we can all actually do. So we know that physical activity has been shown to have a very positive effect on the brain. And the way, to understand that is that when we are actually doing physical activity, it not only helps, create what we called increased neuroplasticity, which means increases the capacity of the nerve cells to make more connections, which is neuroplasticity, but it also helps generate a certain what we call neurotransmitters or chemical messengers, which also helps with emotional balance, and they help reduce anxiety, and they help improve our cognitive health. We release something called BDNF, which is brain-derived neurotrophic factors, which are very important for our mental health and for keeping the function of the brain intact. So that is why it's very important that we do physical activity on a day-to-day basis. Now, there are many ways in which we can keep a step count. You can do that with your smartphone. A lot of smartphones actually have apps to be able to track your steps. We can also use smart watches, which are very popular these days. However, one of the very important things to understand is that you want to get a smartwatch with low EMF, and that is with low radiation. And so you will have to do some homework to see how you can get a smartwatch with low EMF or radiation that can still count your steps. The third and very important thing is that you want to start slow and you want to gradually increase your step count. Last but not least, going outside is a better idea than doing your physical activity inside. And the reason is because, if you're outdoors and you get sunlight, then that definitely helps with increasing your vitamin D. If you're surrounded by trees, this is a phenomena called forest bathing, which basically is that when you are walking with your surrounding with trees and greenery, then that actually helps reduce your cortisol, and that actually has additional benefits for health. So those are some of the things to keep in mind as you're trying to increase your step count. Last but not least, we also know that higher step count can also reduce the risk of some very important health conditions, which obviously can lead to adverse health consequences. One of them is cancer. What we now know is that not only does increasing physical activity reduces the incidence of cancer, it reduces the death from cancer. We also know that exercise is safe and helpful before, during, and after cancer treatment. So if somebody has cancer or a history of cancer, one of the ways to keep the cancer away is to make sure that you increase your step count. The second very important area where increasing your step count may be extremely beneficial is going to be diabetes, because we know that increasing physical activity makes your body more sensitive to insulin. And the more insulin sensitive you are, the less insulin you need, and the better your sugar control is going to be. We also know that in addition to helping control your blood sugar, increased physical activity can also lower the risk of nerve damage in diabetes. And we know that neuropathy is one of the very uh, dangerous complications of diabetes. So you can actually reduce that complication through improved physical activity. The third and very important area where physical activity and increased step count has made a difference is heart disease. We know that increased physical activity can reduce high blood pressure, it can reduce bad cholesterol, and those have all been shown to be independent risk factors for heart disease. We also know that people who are less active and less fit have a 30 to 50% greater risk of developing high blood pressure. So, in short, we can clearly see that sitting is the new smoking. So, if you're not walking and your step count is not adequate, then you are increasing your risk of a lot of chronic diseases, which will then go ahead and affect your quality of life, which will increase your risk of health complications. So, this is the time to take control of the situation and start walking and counting your steps. For those of you who have not subscribed to our channel, please do so for latest medical researches and wellness tips. If you like this video, please go ahead and click the like button. Thank you so much, and we will meet again with more health information. Thank you.